Okay, so let's focus on the Eastern Cape health sector now with growing COVID-19 cases. Yesterday, as Linda mentioned, we brought you disturbing accounts from hospitals in the province. Not enough beds or oxygen or staff. Patients dying in wheelchairs. One doctor telling us half the casualty admissions don't recover. The province's health sector has been ailing for many, many years, highlighted now by the demands of the pandemic and the second wave. I'm joined by the province's health MEC, Sindiswa Gomba. MEC, thank you very much for your time. We appreciate it. First of all, could we start with an update on what's going on with the COVID second wave in the province, with particular concern in areas such as Nelson Mandela Bay? What can you tell us?
Thank you very much. I must admit that we are seeing resurgence of COVID-19, in particular leading in that is Nelson Mandela Bay Metro, followed by Sarabatman. And as we look at these areas, we're seeing numbers that every day are getting up. But on this side, one may want to believe that there are two issues that, for me, are what we've analyzed. First is non-adherence to regulations, where our own communities do not wear masks in the first instance, do not observe social distancing, but equally, they party like there's no COVID. They enjoy themselves in taverns without masks as if it's normal. Those issues for us are concerning. They are concerning in the sense that it is the youth that mostly is in those areas. It is the youth that goes to the beaches. Whatever sun you see, you find them in numbers. And as they get there, they go home to elderly people. Naturally, elderly people with their commodities will be easier when they are infected. And when they go to hospitals, majority of them, they go there very much unable, under stress, distress, because they can't even breathe, some of them. This is why, as a province, we actually took a decision to mount oxygen spaces right in the casualties for when we receive them without knowing, first thing, whether we have tested or not tested.
Minister, MEC, you said there were two issues. One is the non-adherence. What is the second issue?
The second one is that, remember, when the first wave came, as the Eastern Cape, we actually employed contract workers. Contract workers in their nature are not stable people. So if there are positions in others hospitals that promise a permanent job, they leave us. And at the time that our own healthcare workers are affected, we need fresh ones to rest the others.
Yeah,
and it is where the hardest sit.
Yeah, it's a very difficult issue, and you're quite right that people are partying like there's no COVID. Of course, that is really for the police to monitor, and I know from speaking to the Premier's advisor that there's going to be a strong push this holiday season in actually monitoring the public to make sure that compliance with those safety protocols is in place. So let's focus on the hospitals. Nahawu is saying they want you to focus on the hospitals because that's where all the concern is. I'm sure you're aware of the reports we had yesterday, which shows chaos in the health system, exacerbated, of course, by COVID-19. The health minister himself has indicated he is very unhappy with the way the health system is being managed in the Eastern Cape. Do you take responsibility for this, MEC?
I would want first to explain something here. The pictures I saw are pictures that were in Doranginza in the first instance. You must remember, we renovated our own hospitals. If you know Doranginza, the old site that was left unused has now been renovated, and it is very much now an area that is habitable. What we did, we opened Doranginza to immediately move those people that are in your pictures into beds. And when the minister was here, he saw that as evidence. One ward had 38 PUIs. Those are the people that were fogging the area.
MEC, I understand that there is a lot being done quickly to try and sort this problem out. The reality is, though, that our reporter was there while people were dying, was told about people dying in wheelchairs because bed management is so problematic. We know that oxygen is still a problem. This is now the second wave. I've been hearing about oxygen being a problem in Eastern Cape Hospital since July. I ask again, do you take responsibility for this?
I am still saying we mounted oxygen. We've got bays, we've got bulk oxygen.
Are you saying that our reporter is lying?
The reporter can come tomorrow and verify what I am saying. Doranginza is opened, bulk oxygen has been installed, and I'm saying it is not far from what happens when elderly people leave their homes to hospital already under stress.
All right. I have a quote from that piece from Dr. Mtandeki Klamlashe from Livingston Hospital. He's the acting CEO, and he says the following: 80% of the people who go to ventilation and ICUs, we lose them. We lose half of the people who come to our wards. Now, we know a lot more about this virus. That shouldn't be happening. I ask for a third time, will you take responsibility for the massive problems we continue to see in Eastern Cape hospitals, MEC?
Can I explain further what Dr. Klamlashe meant?
Can you answer my question first? Will you answer my question?
It can't be a straightforward question. When people come with oxygen levels very low and are put on ventilators, their lungs are weak enough to stand a ventilator, and the intrusion of a ventilator on weak lungs. He is actually saying the truth. This is what we've noticed. But there's unfortunately nothing we can do without a ventilator at this level that people come to the hospitals and their oxygen levels very so low.
So I'm going to ask you again, do you take responsibility for the way the health sector is running in the Eastern Cape?
Fortunately, when you started, you said the history of the health services in the Eastern Cape has a long history. I doubt if that long history can only be redone in a year.
You've been health MEC since, I think, the middle of 2019. I acknowledge you inherited a broken system, but you have had a year, more than a year, to make changes, and still we are seeing a chaotic situation. The excess deaths in the Eastern Cape is higher than for other provinces. That suggests bad management, because other provinces are doing a little better at managing COVID-19. Do you take responsibility, Minister, MEC?
And again, I'm saying it's not a matter of a yes and no. Your question is loaded with a lot of other issues. Not only that. For instance, as we speak now...
You know what, MEC? Okay, finish that thought, and then let me allow you a moment just to finish that thought.
We are scrambling to add staff right now. Budgets are cut, and as we cut budgets, we're cutting them by billions for the health department. That then suggests that it's impossible for us to add staff at the current moment. This is one of the issues that today we're discussing at the NAC. To say, as budgets are cut, how do we actually mitigate the impact of COVID? Because we can't add staff on those that have vacancies. We can't add staff on those, majority of them, that we have lost. Those are issues that are not necessarily made by the Eastern Cape alone.
Yes.
They are national issues.
They are national issues. They are national issues. How many posts have not yet been filled? And I ask you this because I understand that there was a Nelson Mandela Bay District Health Manager who was very good and retired in around 2018. Is that position filled in a permanent way, or is it still an acting position? Because this is when you need great leaders.
Nelson Mandela District Manager has been employed as Mrs. DeForce.
Sorry, Minister, MEC, I missed that. What did you just say?
Mrs. DeForce, Darlene DeForce, is the new district manager since last year in Nelson Mandela. So in my time, I did employ a district manager for Nelson Mandela. She is the one who's starting to put the pieces back in Nelson Mandela. Because for some time, Nelson Mandela has been operating on skeletal staff in terms of management. When I got here, Nelson Mandela did not have management. Livingston is still battling and we're still filling those positions.
I hear you, MEC. And then what you're telling me is that you're doing a good job in a difficult situation. So then I ask again, and it should not be a difficult question to answer, do you take responsibility for the way the health sector is being run in the Eastern Cape?
I do believe we're doing our best given the conditions that we're in.
So do you take responsibility?
I'm not sure what you mean when you say take a responsibility.
Well, what it means is, are you ultimately happy to be accountable for what is going on in the Eastern Cape health sector?
I can account for whatever I've done since I joined the department.
And you're happy with what you've done?
So far, yes, in this very short time.
All right, thank you very much for your time. That was the MEC for Health in the Eastern Cape, Sindiswa Gomba.